Welcome to the very important Physicians and Kids presentation on community and systems advocacy brought to you by the Coordinating Center and our partners, the Parents Place of Maryland and Public Policy Partners. For those of you who are unfamiliar with VIP Physicians and Kids, we are a patient-centered medical home program at the Coordinating Center, funded by the Maryland Department of Health's Office for Genetics and People with Special Healthcare Needs and the Maryland Community Health Resources Commission. We partner with pediatric practices in Maryland to coordinate care for children and youth with special healthcare needs. Providing effective care coordination can be challenging and complex, especially for children and youth with special healthcare needs who receive care from numerous providers and systems. That is why we partner with providers, the patient, and their family to deliver a collaborative self-management care coordination model. Participants can expect our experienced community health workers and RN care coordinators to help them address barriers in care, develop a shared care plan, and find resources that best fit your family's needs. This presentation will prepare families for current and future advocacy needs. Our objectives are to provide you with an understanding of the different types of advocacy and the impact it can have on your child and community, and an advocacy framework with tips and tools for building effective systems of care for your child and other children and youth with special healthcare needs in the community. First, you will hear from Renee Everett-Sanzone, the Executive Director of the Parents Place of Maryland, who will talk about community advocacy versus systems advocacy, followed by some tips for families who plan to serve on advocacy groups and/or committees or boards of mission-driven organizations. Then you will hear from Robin Elliott, a partner with Public Policy Partners, who has over 15 years of experience in legislation, the state budget process, and healthcare finance.
Hello, my name is Renee Everett-Sanzone, and I'm with the Parents Place of Maryland. And today we're going to talk about, as a family member who has a child with special health care needs, the importance of your role in advocacy and affecting change to improve the life of children and youth with special health care needs. So the next few slides, we're going to go over a few things, some tips and strategies just to get you started. But there's two different types of advocacy, and there's definitely the role of the family needing to be empowered. One is community advocacy, which is your personal community, right? These are things that make a difference in your local community. It's how you define your community. You getting active at your local level, your county level, your town level, your city level. You might look at joining local transition councils or local care teams, or joining a disability advocacy board or an advisory board. And then there's kind of small picture, very, very, very important. But then there's big picture, which, and then there's the systems advocacy, or the policy or money. So that's the state and federal level. Getting active on the systems level, the state groups, federal groups, state consumer groups are some examples. Groups that really talk about funding for programs, testifying before a General Assembly or a legislative body, and then, bringing your issue to your local representatives. Because the piece that you really bring to all of this as a family member is that you have that lived experience. And we really want to talk about, learning to serve, right? Because we have that lived experience, we are the strongest advocates. And while our advocacy journey starts with our own child, there are going to be times that we're going to be able to use those experiences, our journey, to really help affect that. So, like I said, we're going to talk about some next steps. If you're ready to take that next step, then thinking about some community advocacy or some system advocacy, right? And it can start it can start really super small. So at the Parents Place of Maryland, a lot of times we talk about advocacy and leadership is just meeting the family for a cup of coffee, right? If you working with families that way, or asking one of your local disability groups or a parent support group how you can get involved, right? So there's lots of ways that you can look at volunteering on advisory boards or consumer boards at both levels, because not one is not more important than the other. They're both very, very, very important to making a difference in our young people's lives at a systems level. So we're going to really talk about serving on groups. And there's a lot of different types of groups, so it can get really super confusing, right? But one of the pieces that we really want to harness, right, is your passion with your knowledge and how it can impact change. But it's really important to understand all the different types of groups, right? So there are boards, task force, committees, advisory groups, work groups, evaluation groups, anything else that you can think of. And so we're going to talk about some tips and suggestions. So as we said before, we're going to take some of the next few slides to talk about some tips around you volunteering and you serving. And it does really look very different depending on the various type of groups. But hopefully these next few slides will help you to kind of crystallize or make some decisions on how and when you might want to dedicate your advocacy efforts. So there are some things you do need to consider. One, do you have the time? Two, you have to talk about prioritizing, so which ones are the most important. And three, we're going to need to talk about learning the skills, right? And so I know when we say, do you have enough time, sometimes it may seem like I'm being funny, trying to be funny, and I'm not. We really do need to think, we have to seriously ask ourselves, do we have this time, right? The next slide, we have a tool that might help you figure those pieces out if you have enough time. But so many times we as family members, because we care so deeply and we're so passionate and we want to make things better for families, we have a tendency to say yes a whole lot when maybe we should be saying no a few more times. Prioritizing, right? So if you do have the time, you really do need to prioritize the groups and the request to really make sure you're being very clear about what is the most important to you and your passion. And last but not least, we really do need to talk about how do we learn the skills needed to serve on a group so that our participation, our belonging has the biggest impact to make things better for families. So it isn't just enough that we're a family member and have the passion. I mean, those are incredibly important, but we really need to, that's that fire in the belly, and that's experience that no one brings sitting around the table. But we just need to work on our skills, developing our skills to help us make sure we harness all that power, and that we really are making a difference and making things better. So we have this nice grid here, and when we talk about do you have enough time, right? And prioritizing, right? So there's a grid, and you'll see here the arrow that's vertical up and down. At the top it says high time, at the bottom it says low time. Then we've got a horizontal area, right, that says high energy and low energy. And so really super simple, just get out a piece of paper and draw two lines on it, right? And put high time, high energy, low energy on it, right? And so, think about, so now start thinking about everything that you serve on, right? That you're currently doing with groups, right? So you get that list in your head, right? And now one by one, I want you to write down each of these groups. Is it a group that requires a lot of your time and a lot of your energy? Well, then they go in this top right quadrant of the two lines, right? So it's a lot of time and a lot of energy, right? Or is it a group that takes a lot of time, but you don't have to put a lot of effort in it? Well, it goes on the left side, the top left, right? Or is it a group that doesn't require much energy and doesn't require much time, right? Then it goes on the bottom left. And as you guessed, if it's a group that you're working on that requires a lot of your energy, a lot of your effort, but not a lot of time, right? Goes in the bottom right-hand side of this, right? When you look at it, right, you may find, which is where a lot of us do when we're serving on groups, is everything sometimes tends to fall in the top right corner, right? It's the high time and high energy, right? So when you look at that, you might go, oh, I don't know that I have time to take on one more request, right? And so that's what will really help you to say no, right? But if you end up with someone asking you to do something and you've done this grid, but someone has asked you to serve on a group, and it is super important, and it really is super passionate and really fits with what you value and you see is really, really, really important, then you're going to look, and this grid or this grid is really going to help you to go, wait a minute. All right, all of these things are high time and high energy. Are they really making a difference? Or is this really where I want to focus my energy? And you may have to tell a group that you're currently working with that you need to step away because you want to do something else, right? But you need to, one, give yourself the permission to do that. But two, that really helps you to figure out, do I have the time and do I have the energy? But you do need to also, the last piece here that we're going to touch on is learning the skills, right? And again, it's definitely, important to be passionate about wanting to make a difference and getting involved, and it's really admirable, right? But we need to make sure that our voice and the voice of the families that we're representing is truly being heard, right? So when we talk about the different types of the group, right, we really need to look at what are the different types, right? Is it a committee? Is it ad hoc? Is it a task force? Is it a board? Is it evaluation? And why that's important, because each one of these different types of groups has a different role, has a different purpose. So you really need to make sure that the types of group that you're thinking of joining or that you've been asked to serve on, is it going to accomplish what you feel passionate about, and making, the community advocacy, systems advocacy, making a change, making a difference with that. And then what are the functions of the group, right? How often does it meet, right? Is it does it function as a government group? Is it functioning as it just provides, feedback, right? How is the group run? Is it run basically by consensus, or is it run more formally with Robert's Rules of Order? That'll tell you a lot about the group and its purpose, right? And then how you tell your story. It's a balancing act, right? We want to be able to tell our story. It's very important, right, when we're serving on a group, to tell our story, right? But it should tell our story in a way that it lifts up our experiences and lifts up the experiences that other families are having and are going through in the journey. And we're telling our story to move the change forward, right? We're not telling our stories because it's about ourselves. We're telling our stories because it's about everyone else and how we want to make a difference. And telling it in a way that is the most impactful. And it can be really hard because this is our personal story that we're telling. So having to learn to manage our emotions as we're talking about this is really super important. And then last, but again, not least, is really understanding data, right? Every group should be looking at data in some way, shape, form, or another, right? It is definitely very important to have the emotion and the passion, but when we're talking about wanting to affect change, we really need to also look at data. So we need to look at what we call quantitative data, which is numbers. How many people served, how many providers are there, how many people are waiting for a service or services, how much money does it cost to provide the service, how much money is needed to address the people waiting for services, are just some examples of data. Some other examples of data could be how satisfied are people with the service, right? If people say, well, people seem to be happy with the service that's being provided by X, Y, and Z agency, how do you know, right? Is there a survey that's done of the people using the services so that they can say how satisfied they are, would they recommend them? And so that's all quantitative data. The examples of quantitative data. The other form of data is what we call as qualitative data. And that's the data when we say, how satisfied are you with it, scale of 1 to 4, right? And then tell us why you're so satisfied. And that's where the narrative or the written part or the qualitative part, right? It could be that's where you get the real richness of the story, right? When someone will tell you why are they satisfied, they're satisfied because the person always showed up when they were supposed to. They're satisfied because their child is making great progress. They're satisfied because someone listened to them and really heard their concerns, which are really important data points as you are looking at both the numbers and the story or the narrative that goes with it. So this is just a little kind of toe dip into some of the things you may want to consider as you are beginning your advocacy journey and serving on groups.
Hello, my name is Robin Elliott, and I'm here today to talk about systems advocacy. I am a systems advocate. I work with public policy partners and support many organizations such as the Coordinating Center in making a difference in the lives of families statewide, sometimes even nationwide. What is systems advocacy? At the core, it is taking your personal experiences and using them to improve the lives of many more families. Whether it's just families in your neighborhood, families in your county, in your entire state, or even larger. It can be a very transformative experience for both the advocate as well as the people that the advocate is trying to help. What does systems advocacy really entail? It's ultimately about making sure that policies work for families and that there are sufficient resources to support their families, which can mean money, but can also mean other types of resources. The wonderful thing about systems advocacy is an individual can truly make a difference. That may sound cliche, but I have witnessed it firsthand on countless occasions. I've been an advocate for over 20 years and can attest to the value of individuals advocating. I'll share just one story out of many where I have witnessed this happening. I knew a young adult who, when he turned 21, began his advocacy journey. He had a developmental disability and had experienced gaps in his insurance coverage. And those gaps meant he couldn't get the OT or PT or speech he needed, and it became harder for him to maintain his independence under those circumstances. He had experienced this and wanted to support other young individuals in making sure they had sufficient insurance coverage. So he began his journey by talking to legislators from where he lived, gradually expanded that so he knew many other advocates, some as individuals and some organizational advocates, and he really became the inspiration for groundbreaking legislation that improved habilitative services coverage for young individuals in Maryland. And as a side note, he is now a professional advocate on the national level. So that's wonderful news. So to become an advocate, you don't have to be a professional. There's just some basic steps that we're going to explore today. The first step is focusing on an issue. If you're like me, your laundry list of things you want to change about the world is probably pretty long. Most of us don't have unlimited time. I certainly don't. So the first step in advocacy is really focusing on those things that are most important to you. So pick 2 or 3 things. Then think about what you think the solutions may be. Those ideas could come from your own experience. It could come from research, focusing on there are lots of credible sources that are very accessible now because of the internet. It could come from your discussions with other advocates who share similar priorities. At the core, making sure your advocacy is tied to your own story is the key to success. It's the grounding of advocacy. And so advocacy is about telling your story. The next step is to think about joining an organization to support your advocacy efforts. Organizations sometimes have resources that it's difficult to muster when you're an individual. Things like tracking bills or conducting in-depth research on an issue. So this can really be an efficient and effective way to become an advocate. To select an organization, of course, the first thing is you want to make sure its mission aligns with your perspective. And then the second thing is really looking at, does that organization foster and support individuals who want to share their stories and become advocates? There are lots of organizations that have mailing lists that keep you informed about what's going on. Organizations also often have policy committees or boards or some kind of way to gather individuals' input and knit them into a broader advocacy mission. You get to know an organization by attending an event, either virtual or in person, and there are often opportunities to become a volunteer, whether it's a short-term volunteer commitment or a long-term that can be a really great way to get to know an organization. And of course, determining who the decision makers are for the issue you're focusing on. A good place to start is the legislators that represent you. If you live in Maryland, you'll see on the slide a website where you can just go to that website, type in your address, and it'll pop up with all of your representatives. Then the second step is really getting to know those representatives. There are two pieces to this. You want to know what their positions are and their stance on the issue you're interested in. And the second piece is, what are they like as people? The important thing when building a relationship with a legislator is thinking about what connects the two of you. This is a small world, so there's probably something. You either know some of the same people, you've gone to the same school, you shop at the same grocery store. There is something there that will connect you to that legislator that will really help cement that relationship so that you can have a long-term advocacy impact on that individual decision maker. The next step is thinking a little bit more about the legislative process. Luckily, you don't have to be an expert and remember everything from your government or civics course in school. You just need to know the basics. There are really two processes, whether you live in Maryland or you live in another state, whether you're working on a local level, a state level, or even a federal level. There is a budget process, often known as the appropriation process, and there is a bill process. The bill process, that's where everything else goes, whether it is standards for schools, coverage requirements for insurance companies. Most things fall under that bill process. In each process, there are different legislators who sit on committees that focus on those two pieces, the budget and policy bills. So as you're looking at and getting to know your legislator, it's helpful just to be aware of where they sit, what committees they sit on. And often there are either state agencies or local agencies that are in charge as well as part of the process. So there's usually a budget office in your state or county. And for the bill process, there's usually a health agency, a disabilities agency, who are also providing input. This made me nervous. And then over time, I practiced and I became aware that this is just about connecting to that legislator as a person. There are some tips you can use just to make sure that you get in everything you need with an interaction with the legislator. The first one is always identify yourself, especially if you haven't met before. And it's really key to identify yourself as someone who lives in their district. So you don't have to give your exact address, but you can say, my name is Robin Elliott and I live in this neighborhood. Then they know that you're a voter. It's also helpful to state right at the beginning what issue you want to talk to them about. That way they know how to focus on the conversation for the rest of your discussion. And come knowing that they might not be an expert on the issue. They have many things that they deal with. For example, in Maryland, legislators often see 2,500 bills each legislative session. They, of course, can't be an expert in all those bills. They're really looking to their constituents and advocates for input to help them sort through all those issues. Also tell your story. Legislators want to learn about your personal story. They want to understand their constituents and how they can help. And of course, ending the conversation with a thank you is always helpful. And then finally, always weave in an opportunity for follow-up. Advocacy isn't just one meeting, one email, one conversation. It is an ongoing relationship with that legislator, with that decision maker. So creating that opportunity for follow-up, whether it's setting up another meeting, inviting them to visit a program, or telling them that you're going to follow up with additional information. Always build that in. It's very helpful. Now, thinking about life stories in advocacy, and if you think that the organizations working on this video that you're viewing today might be helpful, I wanted to share some opportunities of working with us. First off, follow us on social media. That is sometimes the quickest and best way to get the latest. Also, we all have mailing lists. Join them and you'll get our information on a regular basis, including information about advocacy opportunities. And this is a two-way relationship between the advocate and the organization. So part of this is for you, the advocate, you, to share your stories with the organization you're reaching out to. It's important organizations know who's interested in their work and mission, what their experience is, and how an individual might want to be involved. There are also many events where you can get together with advocates who are working on similar issues and talk to legislators. One event we wanted to highlight today was there's always a Maryland Developmental Disabilities Day with the Maryland State Legislature. The Maryland State Legislature meets from January through April. So just check our websites, join our mailing list, and see social media, and we'll alert you when the next Developmental Disabilities Day is coming up. Very excited that you are interested in this advocacy journey and looking forward to seeing what you do next.